Okay, maybe we can start. People are slowly joining, and we can give another minute or two before we get started with this workshop. But in the meantime, I would like to welcome those who are already there to this Get Ready for AIDS 2024 workshop, where we are going to focus during the coming hour on how to write a scientific abstract and submit to the conference, where we hope we will see many of you. So my name is Marlène Mra, and I'm the executive editor of the Journal of International AIDS Society. And I will be facilitating this workshop today with Dr. Alberto Rossi, who is the managing editor of the journal. Alberto, do you want to say a few words?
Yeah, welcome everyone. Thank you for taking the time to participate in this workshop. And we look forward to seeing your abstracts submitted to the conference.
Okay, so maybe let's get started. It starts slowly, so people will have time to join. We are the editors of a journal of the International AIDS Society, and the journal, next slide, please, is a peer-reviewed journal, and the aim of the journal is really the dissemination of essential HIV research on many aspects and disciplines. It goes really from basic science to implementation science, political science, clinical science, and I'm probably forgetting some and more. The journal encourages submission from low and middle income countries, and we also do provide capacity building opportunities as we do today. Today is the second edition of this workshop, as well, there's full week to submit to AIDS 2024 your abstracts. But we also do during the year other type of workshop and capacity building initiative like this one. We encourage you to look at our website. On our website, you will find also resources or in other languages like French, Portuguese, and of course English. And I think we may have also one in Spanish as well, if you dig a little bit. And so today we will be focusing on how to write a scientific abstract. Next slide, please. So this is the agenda of today's session. We will spend a bit of time to focus on the abstract structure, and you will see that it might be a bit intimidating, but it's really simple and in a way very standardized. So once you have the clues and the codes and know what to put where, it's actually kind of an easy exercise. So we'll spend time looking at how to write each abstract section. We will talk a little bit about the importance of language and HIV terminology, and we'll give you some insights on what is happening once you have been writing your abstract and submitting your abstract. So behind the scene, what is happening at the level of the conference team when they receive, how are they reviewing, scoring, and so on. And the hope is really for you to use this workshop today to write your abstract and submit it by, well, Tuesday next week, which is the deadline for submission. So we're very excited. It's going to be hopefully a very collaborative and lively workshop. You can write the question in the Q&A part, and then we'll take some time at the end of a workshop to respond to any question you may have. And on that note, I'm going to hand over to Alberto, who will start with the first part of this workshop. Thank you.
Thank you, Marlène. How to write a conference abstract. We're going to start with a quote. The quote says, "The key to writing a good manuscript is to tell a story." And of course, this applies to writing a good abstract as well. So you want to make sure that you tell a story and you follow a logical flow. So what is an abstract? An abstract is a summary of your work, of your research. And the key component on this summary is that it's a standalone summary. What that means is that it's independent from your full manuscript. So if I read your abstract, I should be able to understand what you did without having to look into the full manuscript. Of course, the full manuscript will provide more details, but I should be able to understand what you did just by looking at the abstract. It's a section of the paper that convey the most interesting and most important part of your work. And what is the structure of the abstract? There are 5 components. This is, a general recommendation. Then there are the journals or conferences that might have slight differences. But generally speaking, there's a title, introduction, methods, results, and conclusion. And as Marlene mentioned before, we're gonna dig into each one of these sections in the next few slides, so we can provide some recommendation for each one of those. Okay, we're going to try to make this workshop a bit interactive as much as we can, being virtual, but we have a series of poll questions. These are anonymous, so please, don't be shy. Express your vote. So we're going to start with number 1. What is the most important part of a conference abstract? The title, the introduction, the methods, the results, or the conclusion? So we can launch the poll now. There you go. And I'll give you, half a minute to respond to this. Again, what is the most important part of an abstract? I see a note here that says not everyone can vote, but please try to vote. We might have a little technical issue. Okay, I see that it says host and panelist cannot vote. Sorry about this technical difficulty. Well, I'm going to give you the response to this while my team is figuring out what a technical issue is here for the next poll question. So the response to this question is the title. So the title is indeed the most important part of the abstract. Why? Because the title discloses the basic information and helps the reader decide if they will want to invest time to read the full abstract or not. So that's how you catch the attention of your readers and your audience. So how do you write a good title? Well, the title is the part most often read, often the only part read. So again, think about this when you write your title, because you want to make sure that it can catch the attention of your readers. So you should summarize your study in 30 words, and the title should include the what, where, who, and how of your study. Should be specific, short, representative, and informative. And as I mentioned before, it should feel like a mini advertisement so you can catch the attention of the readers. Do not present your lessons learned, no recommendations in the title. That can be included later in discussion conclusions, but not in the title. Okay, so hopefully we have found a way to fix the technical issue with the polls. So the poll number 2 would be for you to tell what is missing from this title. So I'm going to read it for you, and I'll give you a bit of time to think about this. So factors that influence reinitiation or complete discontinuation from daily oral prep use a qualitative study from Eastern Cape Town Province, South Africa. So what information is missing in this title? The what, the where, the who, and the how. So let's try to launch the poll, and I still see that polls cannot respond. So let me see if there is something that I can do from my end to fix this. This is the first time that this has happened to us. Okay, I don't see a way to fix this. Okay, I apologize for this technical issue that we seem to be unable to fix. I cannot vote myself, so it's really not. Apologies for this.
Alberto, we have some participants in the chat saying that they can vote.
They can.
Yeah, they can. So I think it might be worth trying to see if we can show the results.
That's the thing. I do not see an option that normally have to show the results. Okay. Can the editorial team maybe see if they can overwrite me and share the polls results? Okay. Well, I guess I'll give you the answer to this one as well. But not right now. We're first gonna look into this title. So let's dissect the title. So factors that influence reinitiation or complete discontinuation from daily oral prep use. So that's the what. That indicates what the researchers did in this study. A qualitative study. So that indicates how the study was conducted. Okay, now I was briefly able to see the poll results. Okay, so correctly, so most of you, so thank you for the team to fix this technical issue. So most of you indicated that the who was missing from this title. So let's see if you all were correct or not. So a qualitative study, so that's how they did the study. And then the title goes on from Eastern Cape Province of South Africa. So that indicates the where. Now, to be true, this was intentionally modified. So this is an article that was published in JIAS a few weeks ago. And for the purpose of this workshop, we modified the title. You can see in there that in the original title, in purple, the authors have put the who part of the title. So adolescent girls and young women. So what you see now is a correct, full, complete title that responds to the what, who, where, and how questions. So now we're going to move into the introduction. So the introduction should be covering 3 main points. The topic of your abstract, so what are you discussing about? Sorry, I think this was meant for Marlene.
It was, but that's okay.
Sorry, I was on a flow. Okay, go ahead, Marlene. Sorry about that.
No, that's okay. Just before so we're gonna just like alternate a little bit between Alberto and me, and just before getting started a little bit about what the introduction and what we need to put in the introduction. Just something that I want you to notice is that the way you're gonna write an abstract for a conference is exactly the same than the way you're gonna write an abstract for a paper, like a paper that you plan to submit. So the structure is going to be very similar, depending on the conference or depending on the journal, actually. There might be slight direct, differences, but the construction of an abstract, whatever it is for a conference, submission to a peer-reviewed journal, it's always the same. It's always organized with a title, an introduction section, a method section, the results, and then the conclusion. What may differ depending on, like if it is for a conference, sometimes you may be able to add a figure, which we will never be able to do for a journal submission. But that's why we're using example of paper submitted to a journal. Really, the similar rules are applying there. So Alberto told you about the title and all the important information that you need to be able to provide at a glance to make sure that, oh yeah, this is an interesting topic for this conference or this journal, actually. But like all the information for you to already just at a glance get good understanding of what will be in the abstracts, the conference abstract in that case. The more you go into the different part of the abstract and the more you're going to give information and elaborate on this, like who, where, what, and how. In the introduction section, the main part, and we always go in this funnel way of doing things, is like the main part is really looking at what is the topic. Like this first thing that you need to make your readers, reviewers, other delegates will attend and go see your abstract or listen to your abstract or not, is just what is the topic. And that may be very different depending on your area of research. And we put 2 examples of these slides. Is it on DSD in West and Central Africa? Is it more on prevalence of HIV and other STI among female sex workers? And it can be many, many more things. But the general topic is the main part. It's how you start your introduction. And then you go on the issue, because you haven't done that research and you are not presenting that abstract just by chance or mistake. Your research was addressing a problem. There was an issue. But maybe, I don't know, there was in your setting low condom use amongst MSM, or a low uptake of PrEP among adolescent and young women. So you need to state what the issue, what is the sort of question, like why did you do this research? And then again, you go more specific, and that's a critical part, is what was the aim of your study? And that's where you have to be extremely specific, like what were you trying to do, and basically what will you be reporting on in your abstract. And again, you have two examples here. Is it to estimate the proportion of pregnant and breastfeeding women receiving routine HIV care in maternal and child health clinics in Kinshasa, or it was to compare the home-based HIV counseling and testing with provider-initiated testing and counseling. So just example, but I'm sure you get this idea of like general, it is about this topic, and then I'm doing that because there's this problem, and my study is answering to this small part of a problem, and I'm going to tell you about that bit. Next slide, please. So we like this, as you've seen with Alberto, and hopefully the poll will work now. We like this, like making you read that and trying to figure out what is missing for you to have all this important information. So this is a part of an abstract of a paper that has been published last year in the journal. And as I was saying, abstract of a conference, for conference, an abstract that will be the beginning of a research paper, exactly the same. So let's read together this example. Adolescent girls and young women use PrEP. We sought to understand factors that influence adolescent girls and young women's prolonged breaks in PrEP use and their decision to reinitiate or discontinue using PrEP in the context of a community-based adherence support intervention. As a disclaimer, we've been sort of cutting a little bit and adapting a little bit the abstract and the different section of the abstract. So when you read that, what is missing from this part? Can you tell what the topic is? Can you tell what the issue is and what was the aim, or what will be the aim of this specific question? So I'm going to give you maybe a few seconds, 20 seconds to read again carefully and just respond whether you think it is response A, B, or C, the topic, the issue, or the aim. And then we're going to look at that together. So I can't see the voting. So if the team see if people have, we have enough people responding. We're a bit of more than 340 people in this virtual room together today. Okay, so I think the votes are stopped now. So it's quite actually distributed. Some of you thought the topic was missing. Others were 22% of you guys thinking that the topic is missing, 51 that the issue is missing, and 28 thinking that the aim is missing. So let's look at the next slide. So let's do it again. What do we know? We know that it is about PrEP and adolescent girl. That's the topic. So we have an idea about the topic, actually. And then the authors are telling us, or the delegates, future delegates are telling us that what they try to really understand were the factors influencing those break in PrEP use and the decision to either reinitiate or discontinue PrEP use in a specific context. So what we have is something very general. It's about PrEP, and we have the aim. But what is missing here was clarifying what the issue was. Like, it's great, okay, you're doing that, but why are you doing that? And to be fair to the authors, we've been deleting and editing the text so it's more readable and easier to read. But what was missing there was the fact that the authors are telling us that the adolescents are facing barriers that are jeopardizing their prevention effective use of PrEP. So this is what the issue and why they're actually going to dig into the factors linked to reinitiation or discontinuation. So in very few sentences, you already have three main information. Next slide, please. The second part, when you've been setting up the topic and the why you're doing that and like the aim of your specific study is to explain how you're going to do that and how you've been doing that. And for that, it's a very easy way of remembering that you have all the information is really trying to answer to those 5 main questions. So when you write up your method section, you should be able to have somewhere, I mean, hopefully in your method section, but at least in the abstract, you should be able to have information about the who. So who was the subject of the study, or who was targeted by the program? What is your population of interest? Oh, okay, little technical glitch. you need to be able to report and explain the what was measured, and it is really looking at your outcome, the effect, the evaluation. So what was measured and what were the factor of interest. And you have examples in the last column, but I'm not gonna read those because it's gonna depend very much on your own study, but you understand that what this can be. Then you need to have the how. So how was the study designed? How was the outcome of interest measured? How was the data collected and analyzed? And you're looking a bit more at the methodology you've been using, the tool, the statistics, and so on. Then we really need to know where the study took place, the where question mark, because what will be relevant for you if you're doing your studies in Uganda might not necessarily be relevant if you're doing your a similar study in France, and not very comparable. So you need to give this information to the people who will attend the conference. And the final point, again, it's telling your audience about when the study took place. And it is important because, let's say everything happened 20 years ago, it is likely very less relevant than if your study was conducted 2 or 3 years ago. So you need to be able to answer 2 or 5 questions in your method section. And we know it's kind of a balancing act, because whenever you write an abstract for a conference, usually you're limited in the total number of words. For our conferences, the AIDS conferences is 350 words, so it's not that much, so you need to use it wisely. So your method section needs to be balanced between giving sufficient details, so we can really measure that the methodology is sound and that you have done the research well, and also taking into consideration the word limits of your abstract, because you still have a lot of things to report on. Next slide. So another exercise, we want you to participate. So we have this method section, and we would like you to think about the kind of information that is missing from this method section. And again, it's looking at those 5 who, how, where, what, and when. So let's read very quickly the text together. We're being told that in-depth interviews were conducted between 2019 and 2021 with purposively selected adolescent girls and young women enrolled in the community prep study. These young women were offered a monthly prep for 24 months at 2 community-based study sites. Interview guides were informed by the information, motivation, behavioral skills model, and data were analyzed using illustrative code report and a case analysis. We're going to give you 30 seconds, and I'm going to stop talking so you can actually concentrate, but look at what is missing. Can you identify who the study population is, how it was done, where, what are they measuring or looking at, and when it took place? Just 30 seconds, and then we will look into that together. So looking at the votes, you may all see on your screen the repartition of the votes. So 137 people have been voting. And I remind you, we have 362 now. So please don't be shy and just let us know what you're thinking. So we had 8% thinking that the who is missing. So the study population is missing, 9% the how, 59% the where, 22% the what, and 2% the when. So let's look at the next slide together and seeing if we can identify those 5 questions. So we know that they have done in-depth interviews and that they have, we know they have done in-depth interviews and that they have analyzed the responses using the illustrative code report and a case analysis. So we have a little bit of an idea of how they've been conducting their research. On the second line here on the screen, we're being told that all those interviews were conducted between December 2020 2019, sorry, and April 2021. So we know when the study took place. We know that the study population was purposefully selected adolescent girl and young women from 16 to 25-year-old enrolled in the community prep study. So we know who the study population was. And then finally, the authors are telling us that interview guides were informed by the information, motivation, behavioral skills model. So we know what they've been doing. Next slide. What was missing here, what you couldn't tell from this method section, is where the study took place. We could not tell if it was in South Africa, as it is here, as we can tell that it was from the Eastern Cape province, or if it was in Portugal. So all those various bits and various elements are collected in this method section. So I'm going to hand over to Alberto, who's going to guide you for, now that we've been setting up the scene, what are we doing and how are we going to do that? Now it's time to actually report on the results. And Alberto, over to you.
Thank you, Marlene. Okay, so we're now going to be talking about results. So you should, the result is that section that describes what finding your question generated. Okay, so it should be specific to your study. So if your question is, for example, A, you should respond with A. You cannot include results that were not described as aim of your study. You need to include the statistical analysis that represent the significance of your research. So be careful using significant because that needs to be backed up with statistical analysis. Don't use generic terms because this is scientific writing, and words as some, many, few, a little bit do not indicate anything specific. Consider about visual representation of your data using figures or tables or graphs whenever possible. So generally speaking, for manuscript abstracts, tables and figures are not allowed. For conference abstracts, such as AIDS 2024, these are allowed. So do consider those, because sometimes it's better to use a table or graph or a figure to display your results. Make sure you use past tense, because this is something that you have already done. So it happened in the past. And make sure that in the results, you do not discuss them, you do not repeat the methods, you do not speculate on the implication of your results. So again, we have a poll for you. I'm not going to read this because it's quite long, and I'd rather give you the time to read it carefully through this. And we are asking you whether this section is wrong because the results are being discussed, or it's wrong because the data are not specific enough, or actually this is perfectly written, so nothing is wrong with this section. So I'll give you 40 seconds maybe to read this, since it's quite long, and then we're going to analyze this together. All right, 10 more seconds maybe. And don't be shy, these are anonymous, so we want know your vote. There's nothing wrong about being wrong. We are here to learn, so don't be shy. All right, I think we can stop the poll and share the results. Okay, so the results indicate that almost 30% of you indicated that the results were being discussed. 59% of you indicated that the data were not specific enough, and 12% of you indicated that this was perfect. Okay, so let's look carefully into this section, and you can see that are many colors here. The reason being that we have changed many words and expressions to highlight why this section, the way that we put it, was wrong. So it started with many children. many children doesn't mean anything. It's not accurate. The original text, which was correct, says a total of 229 children aged more than 6 years. So that's how you want to express that. Then we add with median age at prior enrollment of more than 10 years. So more than 10 years can mean 10 years and 1 month, and can also mean 50 years. So this is not accurate. You want to make sure you are accurate because this is scientific writing. So the correct version was 12.3. Then we're gonna move into the next one, for example, where we said many. Many again doesn't mean anything. The correct version was 214, corresponding to 93% children at results available for red bulb counts. So you can see that in many of these instances, we have changed the text, but the correct way of expressing and presenting the results is to be specific, use numbers, use data, and use the statistical significance properly. Okay, we're going to move to the next one. And the next one is about the use of sex and gender in your research. So sex and gender is a key component of your study. So you should always make sure that you indicate the sex and the gender of the participants of your study. If you only have females or males or women and men, and not the other part, you should make sure that you indicate why this was a single-sex study. Make sure that you present your data disaggregated by sex. So you have you have a full population made of male and females, but you want to make sure that in your table, in your results, you indicate how many were females, how many were males, for example. And also you want to make sure whether there is any specific result or implication associated specifically with one of the two genders or sex. We recommend that you follow this guidelines that you can see here from the Canadian Institute of Health Research. We will be sharing the recording of this, so you can easily find the link to this. Okay, and now we're going to move into figures and tables. There was actually a question before in the Q&A about how to use figures and tables. So first of all, as I mentioned before, make sure you check the guidelines to see if graphs, figures, and tables are allowed in your conference abstract. Usually for conference they are, usually for journals they are not. So make sure you check the guidelines. And then ask yourself the question whether it's easier, it's clearer for the reader to understand your results if they are in the text or if they are expressed in a graph or a table. And we'll see some examples in the next few slides. And make sure if you use tables and graph and figures that they are standalone. So the table itself should be interpretable without having to look into the abstract. So make sure you label your columns and rows and the axes and so on. So for ACE 2024, you can include figures and graphs or tables or images. Here are some of the specific details that you need to follow. And you can also find them in our website. As I mentioned before, abstracts for publication for journals most frequently do not include tables or figures. Okay, so we're going to go into some examples here. So this is a set of data, and we're going to look into whether this is more easily expressed as a table or as text. So you have to think about the space that you have in your abstract and whether it's more convenient to express the results in a text or in a table. So in this case, we believe that it's more efficient and easier for the reader, and also it's more space saving to use a text, because if you look at the data in this table, you can easily summarize them with workshop participants were gender balanced, 49% and 51%, and geographically representative. You can see that all the 5 continents were equally distributed. So again, we would recommend in this example to use text, because in just a few words, you can summarize the full population of your study. Then we have another example. In this case, we will ask you to respond to a poll. So looking at the data that you have represented here, would you use a table in the left, or would you use a graph to describe the population of this study? So we'll give you 15-20 seconds to respond to this. Okay, we can close the poll. Okay, so we have 74% of you indicated that the graph is a better way to represent this data. And in this case, we'll close the poll. And in this case, we would agree indeed that using a graph is easier. It's visually more intuitive to look at the data this way as opposed to the table. Okay, so then we're gonna get into the last section of your abstract, which is the conclusions. So the conclusions must reflect only the data presented in the abstract. So you can't take a tangent and start, describing things that you have not presented in your abstract yet. It should include a take-home message and wider implication of your findings with recommendations and future research. So remember, you have a little bit of space, not much. So do not put any obvious statements or repetition of the results or overgeneralization, because first, you don't have the space. Second, this will not change the impact of your abstract. So we have an example again. I believe this is the last poll for the day. So I recommend that everyone in this case will respond. So we will be asking you whether this conclusion is a good conclusion or not. So I'm going to read it for you. People living with HIV in the United States may soon have several options for long-acting antiretroviral treatment. Our results suggest that long-acting oral tablets will be preferred by many patients over the current daily oral treatment, while implants and injections with longer duration may be acceptable to some. Future research should investigate sources of preference heterogeneity and actual uptake of an adherence to long-acting ART products when available. So think a little bit about this and see whether you think this is conveying all the messages that should be included in a conclusion, which again are take-home message, implication, and some recommendation for future research. We'll give you 20 seconds. 10. And okay, so I see that 66% of you indicated that this is indeed a good conclusion, while 34% of you indicated that this is not. So as usual, we will dissect each sentence of this section and see what they tell us. So I mentioned that we need 3 parts: take-home message, implications, and future recommendation. So we believe that this conclusion is well written. So it starts with people living with HIV in the United States may soon have several options for long-acting treatment. So this is the take-home message. This is a fact, basically, that was described in this study. So what does this imply? Imply that there will be options for patients to consider, and some will prefer to take the daily oral treatment, while others will prefer to take injectables with longer duration. So what should we be doing next, given our results? So future research should investigate sources of preference heterogeneity and actual uptake and adherence of long-acting products when available, because the study was based on a survey. So this is not based on actual data. So it's a preference study. So future research should actually look in real life data to see if this is the expectation that this study described. So we believe again that this conclusion summarizes well the abstract. And with that, I will summarize myself what we discussed so far. So the structure of the abstract: there is a title, and then there is the interaction that should cover the topic, the issue, and the aim. The method section that should respond to the question who, how, where, what, and when. And then the results, which should indicate a key finding specific to the objective of the research. And then the conclusions, which should be a brief summary of the results with a take-home message and future recommendation. Okay. Next, we go into the language, which you might think it's not important, but at IAS and JIAS, and nowadays many other associations and journals, we believe language is actually extremely important. I'm going to read this quote. Language shapes beliefs and may influence behaviors. Considered use of appropriate language as the power to strengthen the global response to the AIDS epidemic. There are two extremely good resources for you to consider. One is the UNAIDS Terminology Guidelines, and the second one is the People First Charter. This have a very comprehensive document suggesting best practices for language. In short, what we recommend is this table here, but we highly, strongly, warmly recommend that you go through those documents to see what the best practices are. In short, again, this is what we suggest using, and this is what we do not suggest using. It's more like, almost mandatory more than a recommendation or a suggestion. So please use people living with and affected by HIV instead of people infected or AIDS sufferer or patient. We don't we use clients, we don't use patients. We use sex workers and sex work. We don't use prostitutes, for example. So please be very careful with the language that you use in your abstract and manuscript and presentation and talks and while you speak to your colleagues, because language is extremely powerful and extremely important. And still on the language aspect, here are some recommendations more on the format of the language. We recommend you always or try as much as possible to use an active voice. So we don't say a paper was published, by Dr. Smith. We say Dr. Smith published a paper. Do not begin sentences with the word it. So do not use it was decided that blah, blah, blah. We say that the experiment was conducted on a random sample. And also be as simple and as short as you possibly can. Most of the time, that's the best option. So here are a couple of examples. So instead of saying we gave much consideration to, you can simply say we consider. That will give you more space in the abstract. It's a more direct and easier message for the reader to understand. Do not say he provided an explanation about. Simply say he explained that. Again, this is simpler, shorter, more effective. Here are some good and bad practices that we as editors we see both for the journal and the abstract submissions. Make sure you respect the word count. Keep your audience and the viewers in mind. AIDS 2024 and the Journal of International AIDS Society are international, global journals and events. So make sure you direct your language to a global audience. Be clear and concise. Make sure to check spelling and grammar. There are plenty of softwares now that can help you do that. If a reviewer or editor see typos in your abstract or article, that's usually not a good sign. And make sure to comply with submission guidelines. Invest that time to read in the guidelines. It will save you much time later. Common mistakes that we see: reason and aims of the study not being clearly described. The methods are incomplete, so the reader cannot understand how you did that study. Or the most important results of your study are not presented. Conclusions are overgeneralized. For example, you may remember that Marlene before mentioned, I believe was Uganda and Portugal. If your study was based in Uganda, you can't simply imply that those results will be applicable to anywhere else in the world. So make sure you don't overgeneralize your results. And implications are not highlighted, so the reader cannot understand what the importance and impact of your study can be. I have one more slide, and I'm gonna give it back to Marlene. It's about plagiarism and use of artificial intelligence. So please note that every journal, or most journals, and certainly JIAS, and certainly the conference team for the abstract to AIDS 2024, we check for plagiarism. We have, best in the market softwares that will be able to detect anything that has been copy pasted from other sources. So please make sure you pay particular attention to that, because plagiarism will disqualify your abstract or article for further consideration. And also, please make sure to use artificial intelligence. If you really want to use it, make sure you use it in a smart way, because it can lead to terrible mistakes. We have seen that before. It can lead to plagiarism, because artificial intelligence will reuse other parts without telling you that this has been reused. And so it will lead you into plagiarism, or it can provide wrong information. So we suggest you refrain from using artificial intelligence to generate any part of your abstract. And with that, I will give it back to Marlene, that will provide a few more informations about the conference submission process and selection process.
Thank you, Alberto. Just I'm trying to paste in the chat. Computer is not responding. Maybe the team can do that, so JIAS team, the link to the abstract submission on the AIDS 2024 website, because you have a lot of information. And I was looking at the Q&A, and some are asking, how much a table counts in terms of word count and everything. And this is very detailed on the AIDS 2024 website. So if the team can, not share that, but paste in the chat the link to the AIDS 2024 abstract submission guidelines, that would be very useful. So I'm seeing, I think, part of your screen, Alberto, but let's move forward. We're going to focus a little bit more on AIDS 2024, as I was saying. So a few important dates, and we are already actually almost at the deadline for submission of abstract, as it will close next Tuesday. So if you have not been submitting yet, I think now is the right time to do that. As the abstract as well, the amendment to the submitted abstract will not be accepted after this date. There's another opportunity to submit for late breakers, but late breakers have really to be sort of groundbreaking research, or research that did sort of conclude between January and April. So if it was studies that took place 2-3 years ago, it will not be qualified as a late breaker. But the deadline for late breakers is 8th of April, and for the opening of a submission, and then the closing will be 2nd of May. Next slide, please. So for AIDS 2024, there are 2 options when you will submit an abstract. Option 1 is really focusing on research conducted in all disciplines. And the organization of the abstract is very much what we've been discussing today. So the background section, which is the introduction, basically, the methods, the results, and the conclusion. The option 2 looks a little bit more at the implementation of programs, project, policy, and the lesson learned from those. So the organization is a bit different, with a background, background section to set up the scene. Instead of methods, it's more a description of the program or the intervention. The lesson learned is the 3rd part, and the final part is the conclusion/next steps. Next slide, please. So if you have not done that yet, what should you be doing when you plan to join us at the conference and submit an abstract for AIDS 2024? Well, obviously the first part is writing your abstract and getting the approval from your co-authors and others. And the things that is not so easy sometimes to do is agreeing also on the order of who will be first and last author on the abstracts. When this is done, you have to create an online profile on AIDS 2024. This is the way to submit your abstract for consideration at the conference. As I was mentioning, deadline is next Tuesday, and be careful when you will submit. You'll see that there are many tracks and subcategories, so make sure you are submitting for the right track. And we're going to see in the next slide the different tracks. So for AIDS 2024, there will be 6 tracks. The track A is focusing on basic science. Track B is clinical science, while track C has a focus on epidemiology and prevention science. Track D will be all about social and behavioral sciences. Track E, implementation science, economics, systems and synergies. And finally, track F will really focus on political science, laws, ethics, policies, and human rights. Next slide, please. So behind the scene, what is happening? So you've been writing your abstract, and by now you know everything about how to write a good abstract, but what's happening after when it is in the system on the side of the conference scene here? Well, as Alberto was saying, all the abstract will be checked for plagiarism. That is the first step before even being sent out for review. We check that the abstracts have not been already presented or published somewhere. This is a condition to submit an abstract at the conference. It should not be a work that has been already published. So we're going to look at plagiarisms, even if it's self-plagiarism, meaning that if you have been already publishing it, it won't be accepted. Then once we have checked that and make sure that the submission has been in the right track, all the abstract will be reviewed that the abstract that meets the criteria, meaning that are not plagiarized, will be reviewed and scored. And we aim to have at least 3 reviewers per abstract. And each reviewer will give a score, and we will discuss that in the coming slides. And so each abstract in the end has a global final score, which is the average of all the different score of all the reviews that I received. There's a problem. The program committee, the scientific program committee, might act as backup reviewers if there are a lot of discrepancies. Let's say an abstract that is scored 1 by one reviewer and 6 by another reviewer. So then in that case, we ask for additional reviews. And based on this all scoring, a very big meeting will be happening this year in March, which is what we call the marathon meeting. And during this meeting, we have all the different committees, all the different track members, so for all the 6 track A, B, C, D, E, F, who are there, and we'll review the abstract and decide on the abstract that will be allocated to oral abstract sessions, the one that will be oral posters or posters that will be in the exhibition. And this is done based on the score that has been allocated by the reviewers. There's always a cutoff score, meaning that not all abstracts submitted will be accepted for the conference. But yeah, we will again discuss that a bit later. And then the final step, which is the one enjoyable also for everybody, is actually the conference here, and you will get to present your abstract depending on whether it's an oral or not. So I mentioned that each abstract will be reviewed by at least 3 reviewers. Those reviewers will look at 6 different areas and give a score. And the total score is the average of scoring. So for the 2 options, the reviewers will look at various criteria. For option 1, they're going to look at whether the background is clear and the objectives are justified. They're going to look at the methodology. Is it sound? Is the design appropriate for the objectives? They're going to look at whether the results are important and clearly presented, and whether the conclusion are presented by the results. And then finally, they're going to look at the originality and what it brings, what is new to the field, what is the new contribution to this research. For option 2, it's very similar as well. They're looking at the soundness globally of the abstract. So is there a clear background and a justified objective? And are the programs, the project, the policy design and implementation appropriate for the objectives? Are the lesson learned or best practices important and supported by the findings and clearly presented? And I cannot re-emphasize enough, never overestimate the results or overstate the results. That just look at the honest reality of your results and what you can conclude from those. So are the conclusions supported by what you're presenting? And then finally, we look at whether the work is original and whether it contributes to the field. So very, very similar criteria in both options. Next slide, please. I'm looking at the time. Okay, I'm going to try to go very quickly because I would like us to have a little bit of time for answering to some of the questions. But this is comparing to AIDS 2022. So you know that IAS conferences are alternating, and sometimes we have what we call the big conference, which are the AIDS conferences. This is the smaller one, which is the science conference, like IAS 2023 that took place last year in Brisbane, Australia. So we're comparing with AIDS 2022 as we are engaging in AIDS 2024. But very quickly, last 2 years ago, actually, there was a little bit more than 602 abstracts submitted, and only 39% ended up being accepted during the conference. Next slide. So this is a disaggregation per track, but I'm not going to go into detail. But just to give you an idea, previous slide, please. Just to give you a little bit of an idea that globally, among the ones that were accepted, so that met the cutoff, around 5% were for all abstract session, 11 were poster exhibition, and 83 were e-posters. This format will change for next year as we're going to have less and less e-posters and more poster exhibition. Next slide, please. For the late breaker, we receive a bit more than 650 abstract received, and 16% were accepted. Those ones are usually more sort of groundbreaking, hot science, so they're sometimes more likely to make it to all abstract than others. Just a last, maybe, but very important point is that to remove financial barriers so that everybody can attend the conference, and more specifically abstract presenters, the IAS and the AIDS conference has a scholarship program, and the submission, like the submission for the abstract, will close next week on the 23rd of January. So I encourage you to also apply if you want to submit an abstract, and if finances are a barrier for you, to also apply for a scholarship, and to make sure that you include your abstract submission number in your application. And Alberto will come back on screen, and we're going to try to answer to a few questions, and maybe if we all have time to say, but maybe 5 more minutes to answer to some of those.
Yeah, thanks, Milan. I'll give you a break so you can get some oxygen, and I will respond live to some answers that I have already given in the chat, because I think I want to make sure that everyone can see and hear them. So the first one was on whether language can be a reason for rejection. I'm tempted to say yes, because in the guidelines, we specifically say, please make sure you follow this language recommendations. Most likely, if language, use of wrong terminology, such as HIV infected, for example, if that's the only problem in your abstract, most likely you will be asked to correct that. But again, technically speaking, that could be a reason for rejection, because our guidelines are very specific, recommending to use the recommended terminology. And then another question that I believe can be general for everyone is whether abstracts that are already published can be submitted to AIDS 2024. And the answer is no. Only new, original, unpublished research can be submitted for consideration at AIDS 2024. If your abstract is already published somewhere else, there is no reason to republish it or resubmit it to AIDS 2024. So only original data that has not been shared already. Okay, and now I'm going to try to go through the questions. There is one about late breakers. Len, you want to take that since you mentioned briefly? So one is asking, why are there late breakers? What's the reason for giving a second deadline for these abstracts?
Well, you want the science presented at the conference to be as relevant as possible. So let's say you were waiting for a massive or trial that has just been concluded between 23rd of January and I can't remember, 2nd of May. Obviously, if it is very important to the field, you really want the participants and the delegates to be able to see the results. So that's why late breakers are really, and it's a small number, but it is really dedicated to this sort of a hot science in the making that we all expecting and hoping to see whether it is, some results, usually results of ongoing clinical trials.
Thank you. Somebody else is asking about deadlines, whether you can submit the abstract by the 23rd and then the scholarship later. No, those deadlines that are up on the website and in this presentation are strict deadlines that we ask everyone to meet. Otherwise, it just gets too impossible for the team to handle, several waves of, submissions. I believe we are a bit over time, but we can. I've seen a few questions about word count. My understanding is that the instructions are, I don't have the instructions with me right now, but the instruction on the website, if what we presented here wasn't very clear, please do consider looking into the instructions on the website because they're very clear. Each table counts a number of words, each graph counts a number of words. So please make sure to follow those guidelines.
And I would say, worst case scenario, if there's something that is not clear, please shoot an email to the conference team. They will be able to answer very quickly to any request you may have if you feel that the standard sort of answer that have been drafted on the website do not respond to your specific question. Just answering two very quick questions. There was one participant asking us whether an abstract can include both quantitative and qualitative data. Absolutely, you can have mixed methods work, and that's completely fine. So that is absolutely possible. And another question that I saw was, can we submit the same abstract to two conferences? And the answer is usually no. That's what we're looking when we look at plagiarisms and whether it has been already presented or not.
There are a few questions about second deadline and so on. Yes, the late breaker is an opportunity for those that can't make the first deadline, but again, with the caveat that there needs to be a reason as to why the abstract is submitted later, such as clinical trial ongoing, as Bernard explained before. So short answer is you should try to meet the first deadline because that's where most likely your abstract can be considered.
Okay, with that, we a bit above or beyond, sorry, the time. So we just would like to thank you very much for your time, your attention. You will see that there's, I think, either a pop-up for the survey to complete, or it has been for sure pasted in the chat. So please let us know what you thought. It's always useful for us. And then we wish you best of luck, and we hope that you will submit, many of you will submit by next week, now that you have this little reminder of how to write a good abstract. And if you're at the conference, coming at the conference in Munich, please come by and say hi. All of us, Alberto, myself, and all the JIAS team will be there and will be happy to chat and meet with you. So have a good rest of the day, wherever you are in the world, and thanks for participating.
Thank you, everyone, and best of luck.
Bye.